We have all experienced minor headaches at some time. The cause could have been the flu, watching TV for too long, not getting enough sleep, or any number of other reasons. But there are other more severe types of headaches. They may last for weeks or months. The pain may be so intense that the sufferer is incapacitated. There are several kinds of headaches, but three major types: migraine, cluster, and muscle contraction account for 90% of headache symptoms. Migraine comes from the Greek, meaning half the head. In an attack, which may be preceded by spots and flashes before the eyes, either one or the other, or both sides of the head throb or pulsate with pain. Other symptoms may include nausea and vomiting, blurred vision, and unsteadiness. The attack may last from a few hours to several days, and the pain may range from mild to unbearable. Cluster headaches come in bunches, 1 to 3 a day for several weeks or more. They're cyclical in nature. A period of attacks may be followed by a period of no headache activity at all. Then, once again, the attacks may occur. They affect only one side of the head at a time. The pain is very severe, enough to arouse you from sleep. Attacks last from a few minutes to a couple of hours. They often occur during the spring or fall. Migraine and cluster headaches are both vascular headaches. The primary cause of pain in vascular headaches occurs when blood vessels in the head dilate or expand beyond their normal limits as a result of disturbances in their function. Some people are more likely to have a vascular type headache because these blood vessels in the head are vulnerable to certain stimuli. The chemicals in certain foods, odors such as perfume, smoke, exhaust gases, changes in barometric pressure, stress or anxiety, all can trigger a headache. In addition, sudden movement of the head, bright lights, or loud noises can aggravate a headache. The third major type of headache, the muscle contraction or tension headache, is caused by contraction of the head and neck muscles. Muscle contraction headaches are brought on by emotional stress, frustration, depression, anxiety, and you need not even be consciously aware that these are present. You get a steady feeling of tightness or pressure on both sides of your head, on top, or all over your head and neck. When chronic, it can last for weeks, months, even years. With migraine and muscle contraction headaches, you can get caught up in a vicious cycle. Stress triggers a headache. The pain upsets you. Now there's more emotional tension. The headache worsens, and so on. We've accounted for 90% of headaches. What about the rest? Some of these are simple occasional headaches brought on by the flu, sinus problems, lack of sleep, excessive alcohol, or viral illness. For these, aspirin and rest may be the best medicine. In a very few cases, headache is brought on by some more serious condition, such as a brain tumor or aneurysm. But this is rare. The severity of your headache does not indicate how serious your condition is. That's why, when your headache persists or continues to recur, it's time to consult a physician.
Now that we've finished your background medical history, I want to ask you something about your headaches.
To diagnose what type of headache you have, your doctor will give you a physical exam with particular attention to the head, eyes, neck, and nervous system. He will also obtain a complete history of your headache.
How far back does your history of having headaches of any sort go?
I'd say about 15 years.
Okay, now that would make you about 24 years old. Do you ever recall having headaches prior to that time?
I did have slight headaches when I was in high school, but they weren't really severe at all. They didn't become severe until my little girl was about 3 years old.
You and your doctor are a team who must work closely together to overcome your headache.
1 to 3 times a month. That's been going back now for a good...
Every case is different, and there are a variety of management programs which might be used.
And the longest?
The longest would be a couple.
Cooperation with your physician will usually result in finding a management program that will help you. Because certain foods can trigger a headache, your doctor may advise you to stay away from chocolate, aged cheese, alcohol, tea, coffee, and other foods that aggravate vessel activity. Since certain medications are effective in treatment of headaches, your doctor may prescribe them to fight your headache. Some of the medications in the doctor's arsenal are the same ones used for patients with a heart condition or emotional problems. Prescribing these medications for your headache should not lead you to think you're about to have a heart attack or a nervous breakdown. Every medicine, even aspirin, may result in some adverse side effects. If you experience such side effects, it is important that you discuss this with your doctor. Biofeedback is another approach the doctor might try in your case. Under special instruction, you will be taught to control the abnormal muscle or vessel activity in your head. Depending on your type of headache, you will learn techniques for warming your hands and relaxing the muscles in your head. Electronic indicators show when you are doing this properly.
I want you to relax. That's it. I want you to listen to the tape. The tape will give you directions, step by step, to learn how to warm your hands by this thought process. I want you to concentrate on changing that temperature in the hands to a higher temperature. You want to watch the machines, recognize what thoughts are increasing that temperature, and see how long you can maintain that temperature.
The electronic device is just for training. Once you have mastered the biofeedback technique, you can do it anywhere, whenever you feel a headache coming on. But you must practice a few minutes every day, whether or not a headache is present. Still another approach is to relieve the stress, frustration, or emotional factors that may be setting off your attacks. Your doctor will help you identify the problems you can do something about and those you can't. In some cases where medication is ineffective and the underlying causes are deep-seated, your doctor may recommend psychological counseling. Most headache victims can be helped, both for individual attacks and for patterns that extend over long periods. This is one medical situation where it's absolutely essential that you and your doctor work closely together if the best results are to be obtained. It may prove discouraging at times, but with patience and determination, there's an excellent chance that you will be able to manage your headache.
I'll do my best.
Have a safe trip.